Good afternoon. We're here back at the NMC Specialty Hospital in Nahda, and today I have a very special guest, Dr. Ala Eldin. Doctor, how are you?
Thank you very much. I'm fine. How are you?
I'm very good, thank you. Okay, doctor, I know there's a lot of good things to know about you, so why don't you get started telling us about who you are and your role here at the hospital?
Yeah, thank you very much. So my name is Eldin. I am a consultant at the NMC Hospital in Nahda, Dubai, working as a consultant for interventional cardiology. I'm here since 9 years, meanwhile, more than 9 years, touching the 10. And before that, I used to live in Germany, where I studied the medicine and practiced medicine cardiology for a long time. And before that, born in Jordan and have the Arabic roots.
Very good. So you have quite a journey already, doctor.
Yes. So a mix of all, so Arabic, a little bit some German mentality is also there after 25 years in Germany.
Oh, 25.
So you get something, yes.
Amazing.
Yeah.
Okay, so tell us about your career. How did you choose and what inspired you to stay into cardiology?
Oh, yeah. My desire to the cardiology, or the journey into the cardiology, started actually pretty early during my medical school at University Heidelberg in Germany. Once we started to learn about the organs, different organs, so I got curious about that small organ, that heart as a small organ, not bigger than your fist, but with such a power that actually drives every second of our lives. And over the time, with the residencyship and learning more about the heart, with the advancement we got in the technology, my curiosity and that field became more interesting. It's more exciting. And meanwhile, with the cath lab, for example, we have the possibility to treat complex cases minimally invasive without even need for open heart surgery. So the journey, it was starting really early, and it got always more interesting and more exciting.
Perfect. And you continue being more interested, yes, right? Absolutely. With technology and all. Absolutely. Amazing. Perfect. Doctor, so now with all your experience, and since you've been in so many places as well, let's talk to the people, because we need to learn about, preventing or making sure we act fast when it comes to your heart, right? You say it's very important, functional, pretty much, yeah. So tell us some of the symptoms that people should look for a doctor, anything related to the heart, meaning chest pain or shortness of breath. Please tell us what are the symptoms for the ones who are listening, that as soon as they see that, please consult a doctor right away.
Actually, you name it, Maria. So the main symptoms are the chest pain and breathing difficulty. It is extremely difficult sometimes to distinguish that chest pain is something related to the heart, or is it just an normal chest pain, which happens like muscle spasm or even gastric pain. But my advice is, because even a simple chest pain can indeed be related to the heart, my advice is to seek the help, or at least the evaluation, as soon as possible. So if someone experiences any new chest pain, something not known before, or breathing difficulty more during the exercise, which was not before, palpitations, irregularity in the heartbeat, that is the palpitations. That is also one sign could be sign for serious heart disease.
Okay.
So my advice is always maybe to go more often to the doctor, check that part before being late, because sometimes time is very crucial.
Perfect, especially, yeah, that's great, the doctor. Okay, now talking about, again, all the symptoms and everything like that, there's something that is right now, I think, newer to our society and our generations in the last few, which is stress. Right?
Yes.
Big topic that we all been talking about.
Positive stress and negative stress.
Correct.
The negative one, yes.
Yeah, so why is stress known, and what people say stress is more dangerous for the heart than for the brain?
Yes, stress is a very negative factor, and can have a negative impact on the heart, not only on the mood or on the mind. Physically, or just clinically as well, the stress, it increases the blood pressure, for example. It increases the heart rate. Both are, over a long time, can have a negative impact on the heart and the heart health. The same thing, stress it induces more stress factors and hormones and mediators in the body, which over the time can lead to change in the arteries of the heart, or not only the heart arteries, other arteries like arteriosclerosis. That is the main thing which can affect every artery in the body. And if it affects the arteries of the heart, then we are speaking about heart attack risk.
Yeah.
So these factors all caused or can be caused by stress as a cofactor with other factors as well. So, but the stress itself, indeed, it increases the heart rate, it increases the blood pressure, and it increases the inflammatory response in the body, which can cause arteriosclerosis.
Yeah, that's it. People definitely need to be more aware of that. Okay. And the stress management is key.
Yes.
Okay, now something that you mentioned regarding the stress and heart attack related, it's something that I think, and please let me know if you also seen this, that now we're seeing heart attacks in younger people.
Yes, and that is more frequently in the last few years, to be honest. And it's also some specific for this region, maybe a little bit more specific for this region compared to my experience back in Germany. And that has to do more maybe with the lifestyle, with unhealthy diet, stress factor, more stress on work, so you have less time for your body. And all these things contributes to develop change in the arteries of the heart at earlier age.
Okay.
And I think the lifestyle and the stress factor, which is compared to Europe, maybe is a little bit different. And that is the most important factor which make heart attack is not only a disease for elderly, it can affect also young people.
Yeah.
And for this region, maybe it could be some genetics factors as well. Okay. So from the Asian part, the genetics factor, we see this, that if it comes to younger patient with heart attack and you ask these patients, anyone else in your family, then he starts telling you, my father, my brother, my sister, my cousin. Okay. So I all had heart attack or went through angioplasty at younger age. So that genetics part is definitely very important, but that we cannot change. So that's why it's more important that if someone has this predisposition in his family, then he should be more aware about all other risk factors and healthy lifestyle to avoid or prevent as much as possible to get a heart attack.
Amazing, right? Like even if we have the genetics, there's so many things that we can still do on our own to improve and prevent.
Yes.
Perfect. And going back to that question, do you see is more in between male or females or about the same or?
No, more male, to be honest. Yeah. Females, of course, we have, but not at the younger age. It can happen, of course, we had as well, but more frequent in younger age with the male in male.
Okay, so we need to make sure that those men here in the GCC areas,
absolutely,
on top of really help.
And the preventive measures. It's there are other factors like the diabetes, the smoking, of course, it's in our hand, high blood pressure and cholesterol. And these factors, particularly, now leave the smoking at the side because we know about it. But the diabetes, the blood pressure, and the cholesterol, these are diseases which are silent. So it means if you don't look after them, you don't notice them, maybe you have it for many, many years, and you don't know this. So that's why it's very important to do this health checkups from time to time to see if there's any one of these factors already present, and you can take actions.
Perfect. Amazing. Okay, now tell us about interventional cardiology procedures, how they advanced throughout the years, and is there any in particular that you say, okay, finally this is getting done now?
Yeah, indeed. We have in the cardiology, that is a field, that's why I like it also. Like it more, because we have a lot of developments over the years in the technique with the catheter technique. The catheter is a small tube which we insert into the body through the artery normally, and under imaging, so we see where we are going, and then we can investigate many parts of the body. And for the heart, we're investigating the arteries of the heart. but also the heart chambers and other things. And with this small technique under minimal invasive, so there's no need for open heart surgery, we can meanwhile diagnose and treat complex conditions, heart conditions, without open heart surgery. And the technology and the advancement, what we have during the last years, the devices we use, the stent and balloons, they are getting smaller. They are in the profile much better. There is medicine coated on it with a very good long-term results. Earlier, when we started with the balloon and stents, like after a few months with the balloon, sometimes you get again some narrowing back. So with the new technique, we can have a long-term result, which is very, very good and acceptable. The last advancements also that meanwhile, we can treat not only the arteries, we treat also the valves, the heart valves. Earlier it was only surgery possible. You need to replace the valve with open heart surgery. Meanwhile, it can be done also minimal invasive. So these are techniques which are already there and improves further. And over the year, we'll see also more, definitely.
Perfect. And how these change the patient outcomes, like faster recovery?
Absolutely. We have a faster recovery. We have a very long-term good results compared to the surgery as well. And with a minimal invasive, putting the patient at lower risk during the procedure. It doesn't mean, just to be fair also for our colleagues from the cardiac surgery, which we work with them in collaboration, is excellent collaboration, particularly at our hospital. It doesn't mean that we will not need the cardiac surgery at all. That would be a myth. That is not correct. We still need the cardiac surgery, and that is more important, that the work together between the cardiologist, interventional cardiologist, and the cardiac surgery, that these parts work as a team, because we want to provide the best medical management for the patient, for the individual patient. And that comes only with a discussion and figuring out what is the best option. That doesn't mean that I can do this, I can fix this in the cath lab, then I'll do it in the cath lab. We need to see for the long run what is better. Maybe the surgery, the bypass surgery, though it is an open heart surgery, but for the long run, because of other things, other factors, the lesion morphology or the diabetes or whatever, currently from the guidelines, the surgery is the better option. Though the angiography or the minimal invasive is an option, but the better would be the surgery. So then we refer to the surgery. So it is a teamwork, it's a discussion always.
Perfect. And talking about all this technology, I'm going to ask you something that people talk about, and I want to know. What are and how the artificial hearts work?
Okay, yeah. Artificial, in that case, you would have for a short time 2 hearts. So okay. That is it, yeah. So it's seen as a bridging, actually. Okay. So it's a bridging until the patient gets normally the heart transplantation. Okay. So there are devices, mechanical devices, which mimics the pumping function of the heart. The heart is a pump. So, and there's with this technique, and that's a really great technique, it works, but it's seen as a bridging. So it's not a long-term solution. The devices are too big. They need an anticoagulation or blood thinner. It is they cannot be managed at home. So it means it's only just for bridging. But of course, we are very happy to have these techniques, because sometimes you need really the time to get the transplant, for example. And in that time, you need that bridging. And that is where.
So how long is that bridging? How long a person can have 2 hearts?
Not short, only for later.
Okay,
short time.
That's amazing, doctor.
Weeks sometimes. But
okay, well, we can still.
Not long, yes.
Yeah, perfect. Okay, and tell us about all your experience and everything that you have done so far in so many patients you have treated. Tell us something that has been meaningful to you in your career in the last year or so.
Yeah, I think if you ask this question for any cardiologist or interventional cardiologist, they will come with almost the same answer.
Okay.
But though it's a unique event. It's always the event when we get a patient with a heart attack. Normally, a younger patient. It's not like the patient is not important. Of course, it's important. But when you see a younger patient with cardiac arrest or impending cardiac arrest with severe heart attack, and they rush them to the hospital and to the cath lab, and then you figure out the problem fast, you tackle that issue, and you see the improvement almost immediately afterwards. That is always an amazing, and though the scenario is always the same, but it is never the same. It is for the patient, it's always unique. There are some differences, always small differences, maybe the heart rate, the blood pressure, how low it was, cardiac arrest, no cardiac arrest. And these moments, once it's over and you see the improvement, that is always memorable.
Saving someone's life is always something to remember, I'm sure. We're very grateful for you, doctor. Okay, doctor, the next 60 seconds, we're going to shoot a few questions, and then you're going to tell us the first thing comes to your mind.
Okay.
Are you ready?
Good.
Okay, here we go. Doctor, coffee or tea?
Coffee.
Morning rounds or night shifts?
No, morning rounds.
An essential item that you always have in the cath lab besides the regular equipment?
Defibrillator.
Most underrated piece of technology in the cath lab?
In the cath lab. Imaging technique, like the IVUS, what we call intracoronary imaging, that should be used more frequently.
The smartwatch ECGs, are they helpful or they are hype?
Helpful.
Really?
Helpful, yes.
I always wonder.
But not a replacement.
Correct.
Yes.
But for example, like, you know, if someone is sitting and I'm like, I see something weird, they can use the smartwatch?
Yeah. And
good.
particularly the one with the ECG, you can take the ECG. I don't have it with me, but you can take. I will not do which make is it. I will not do it. I will not tell you.
Yeah.
But but they are really accurate.
Most common misconception about heart attacks that you hear from patients?
That they affect only old people. That's not correct.
One medical myth that you would love to bust?
That heart surgery is not needed anymore. Still needed. Still needed.
Okay, good. One thing patients should stop doing immediately?
Smoking.
Most underrated food regarding heart health?
Walnuts, nuts. Nuts in general.
Yeah.
Raw nuts, because the raw one, not salted or something.
Cardio or strength training?
Both.
I agree. Perfect. A hard fact that it still amazes you. Something about the heart.
That's small, powerful, and beats more than 100,000 times every day.
And a book or movie that is stayed with you?
Movie, The Godfather.
Yeah.
And book, I would choose A Time to Kill from John Grisham.
Very good. Perfect. Well, Doctor, a true pleasure talking to you.
Thank you very much.
Yeah.
Pleasure as well.
We learned so much from you. Thank you, Doctor.
Thank you very much.
Okay, perfect.
Thank you very much.